GPs who are worried their waiting rooms will be overwhelmed by sick coronavirus patients are calling on the government to make all telehealth appointments covered by Medicare. There's restrictions on who can claim a telephone or video GP appointment, but almost 14,000 doctors say that's got to change. The petition's organiser is senior physician Dr. Simon Benson, who joins us now from Melbourne. Good morning, Dr. Benson.
Good morning, how are you?
Tell me what I'm pretty good, to be honest, but, I imagine that the medical profession as a whole is bracing itself for what's ahead. Tell me what the current situation is with these teleconferences with patients.
Absolutely. So you may remember last week the government announced phone and video appointments would be available for GPs and for patients, but they introduced a number of special conditions and restrictions that exclude a large number of the Australian public. What the letter is asking for is for the government to immediately remove these restrictions at a time of lockdown and imminent shutdown to reduce the risk of infection occurring in medical clinics by reducing the commingling of potentially infected and uninfected individuals. The great thing here is that there is no extra cost. Video and phone appointments are rebated at exactly the same as a face-to-face appointment. We're not talking about extra services here. We're talking about changing the way that we deliver care.
Why then have they been reluctant to take it that one step further?
That's an interesting question, and I have absolutely no idea, particularly when the cost is zero.
A lot of the clinics, and I happened to be at one on Friday afternoon myself, they have put in some pretty impressive measures to make sure that commingling doesn't occur. I had to wait outside in the car, ring them when I was there. The doctor came out, took my temperature. All of that is taking a lot more effort. How is everyone coping at the moment, do you think, Dr. Benson?
Doctors are very concerned about the risk of infection to patients. All of these additional measures that you talk about, and at my clinic we're doing exactly the same, are not, are difficult to implement. I mean, how much easier would it have been had you been able to have had your assessment conducted at home via phone or video?
So would you have any restrictions on the telehealth rebate?
I think at this time of crisis, when the number of cases may increase exponentially, I don't think I would have any restrictions at all on the method of delivery for services. Let's let doctors decide on the best and safest way of delivering care to their patients, and at the same time let's let patients decide what method of care they feel most comfortable and most sits with their risk.
Dr. Benson, I know you would be following what is happening in Italy and around the world. Do you and your colleagues feel that you are ready for what is to come?
I think it's impossible to be ready for what's about to come. Certainly the images from Italy and from Iran are scary. I think that the medical profession is as ready as we can be, and we are here to help and protect this nation, and that is a responsibility that I take very seriously.
Simon Benson, best of luck to you.
Thank you.